Hi, and welcome to NCI's Life program. Our wonderful Life program is made possible by the generous support of Barbara Matthews, a wonderful example of the pursuit of learning and wisdom. Some housekeeping items. All of our guests will be on mute for both audio and video today. So if you're just joining us, we do see you and we are thankful that you are here today. But you will not be able to speak or see yourself on the screen that you might be used to seeing. We will hold the questions. Well, actually, we're going to have the questions throughout the presentation. So if you use the chat feature, you can send those in, and Andrea will be seeing those live. So she'll be able to interact with you throughout the presentation. Again, if you have any questions, just feel free to use that chat feature or save them till the end, and I'll make sure Andrea gets to them. This presentation is being recorded and we will upload it to our New College Institute YouTube page within a week. It takes about a week for us to get it and then edit. To find this, please search the New College Institute on YouTube, and then you should be able to find our page on there. And today's live presentation is entitled Patient Advocacy, So You Think Your Healthcare Team is Complete. And today's speaker is Andrea Alamani, owner and president of the Patient Navigation Team. Andrea also serves as the chair for the Advancement Council for the College of Arts and Science at her alma mater, Appalachian State University. She is also active in her Rotary International Club and serves on the board of directors for the Greensboro Symphony Guild. And without any further delay, I will turn this over to Andrea for her presentation.
Well, thank you so much. And let me just tackle the technology of sharing my screen. Well, good afternoon, everyone, and welcome. I am so grateful to be here today, and I'm happy to take your questions as we go along. I just wanted to share this with you because I feel like many of my clients are senior citizens, and I feel like they certainly have this juggle to do with their medication. So I wanted to share this because it's really true. You do really have to look at your medications from the standpoint of the side effects. So I just wanted to go ahead and get into my presentation for today. So you think your healthcare team is complete? Well, I hope that it is, but in case it's not, we are going to take a look at how you can become a better advocate for yourself or for a friend in the world of healthcare, and also the role of independent patient advocates. So let's get started. I know that it's a confusing world in healthcare. Who do you trust and what advice do you take? And just looking at this, you're going to see that some of my favorite references are AARP and a Choosing Wisely program, which we'll talk about a little bit more later. But as you know, if you've been around for a while, you know that at one point we were being told not to eat eggs, and then we were. And what about margarine versus butter and artificial sweeteners? So we get all kinds of advice. And even right here, just a few months ago, we have all this advice, and then in the very, very middle of this, it says everything in moderation, including moderation. So what do you do with that? And so there's always these kind of, you feel like there's advice coming from different angles and certainly different points of reference, and what do you do with that? So for me, I have been an advocate for family and friends for nearly 20 years, and I founded Patient Navigation Team in 2016 to help people because the world of healthcare is intimidating, and you deserve to feel a sense of empowerment. And how can you do that? Well, we're going to walk through that together today. Here's what I would like to tackle with you, and as I said, if you have any questions, just ask me, Brian. I'm seeing a full screen here, so because I'm sharing, so if you could maybe prompt me if you get some questions. So we're going to talk about issues specifically for senior citizens, and then I'm just going to give an overview of healthcare basics for patients and their families. Then I'll finally start talking to you about what an independent patient advocate such as myself can do for you. And then because I'm a chemist, I love reports and references, so I'm going to show you how I built this presentation and other presentations and resources that you can use yourself. I'm going to be repeating some points along the way as we talk about seniors and then basic healthcare information, because I think they're important. And I want to touch on a few situations that are specific to seniors, but will certainly be helpful to all audiences. The first thing I want to mention to you is the term polypharmacy. This is not a new concept. The American Geriatric Society came out over 6 years ago and stated that if you are taking more than 5 medications on a regular basis, particularly in that case, you need to have your medications reviewed annually by your doctor or by another healthcare professional. And what that means is that you discuss each medication, not that they just get refilled because you've been on that medication for some time. So there's always an opportunity there for a conversation. Another thing that's important for seniors is to ask your doctor about the cumulative effects of your medications on your mental clarity. And this is referred to specifically as cognitive burden, and it is cumulative based on the medications that you're taking. And we will talk some more about that later. If you're going to be working with your doctor, there are some great suggestions here for questions you can ask them as a senior citizen. And these are coming from Choosing Wisely. This is an initiative from the American Board of Internal Medicine. And they have a website that has countless resources in there. And the value to that is that you can look at that information from the standpoint of a patient, and the data is in there and questions are in there from specialists, doctors who are specialists. So you really are getting that information straight from a doctor, and it's questions you can ask directly to your doctor. But some of the simpler things that we want to talk about are things that you may or may not be aware of. And so for Choosing Wisely, they have just a few things that are specific to seniors for you to make sure that you're doing. And the cancer screenings are you can see here, you just want to ask, if you're in that age window, you just want to make sure you're getting those screenings. And then once you're past the age of 75 to 80 years old, some of these screenings may no longer be beneficial to you. So that's a question you should ask your physician or your healthcare provider. The answer rather, will be individual for each one of us. So another thing for you to consider is that you may want to talk to them once you turn about 60, is talk to them about vaccinations. Now I know now there is Shingrix, which is the shingle shot, and it's actually two shots. And so you want to ask about that one, but there are others too, such as the pneumonia shot. So just make sure that you're getting those in a timely manner. And in addition to that, I just want to mention that make sure you're keeping up with your boosters as well. I can't tell you the number of people that I've talked to about a tetanus shot, and they don't remember the last one they had. Well, it's pretty important to make sure that you're getting that booster every 10 years. So make sure that you're doing that. And then, of course, there are the questions about bone density for women, and then for women, younger women or men over the age of 70. So just ask about that. There are also a few things that you might want to consider asking about as you grow older, and do you need them? And of course, that first one, an antibiotic for a common cold, is going to do you no good no matter what your age. An antibiotic comes into play if you have an opportunistic bacterial infection that's happening there, in addition to the virus of the cold. So that's something to think about. Vitamin D screening may be something that you want to consider. Also, some things that you may not need to do are things like imaging tests for lower back pain. You may want to have some diagnostics done before you start doing a bunch of imaging testing there. Cancer screenings, of course, I think we talked about that, but once you hit about the age of 65 for women, you may not need to continue a Pap test, and then depending on your prostate history, you may not need to continue the PSA test as well. And then, of course, opioid pain medications are always a big concern, and we just want to make sure that the benefit of taking those is going to outweigh any risk to you. So that's just another discussion to have. The thing I want to do now is give you permission. AARP and patient navigation team give you permission to ask these questions. And I found this in AARP bulletin about a year ago, and I think it's so important to remember it is okay to ask that information be repeated or to ask for printed materials. Also, you know, if you feel like you just need a moment alone with your physician where the nursing assistant or the nurse is not in the room, you have the right to have a private moment with your physician and ask a question that might be awkward for you. Another thing to consider is they're suggesting something to you, and it's okay to say, what if I can't do what you're suggesting for whatever reason? Because there may be an alternative that can be customized for you. So make sure you ask that question if that's your circumstance. Also, if you are willing and able to tackle the whole idea of a patient portal, that's a great wealth of information about you and about your physician's practice. So engage with that opportunity if possible. I know that for some of us, computers are not the most enjoyable thing in the world, and we're certainly kind of tied to them now for sure, as you know, by having Zoom meetings repeatedly. So, so just be aware that that is a valuable tool as well, and you will have to ask for information to log on to that. Does anyone have any questions at this point? Okay, so I think we're going to start talking about just some basic ideas for having a better relationship with your doctor. And this is one of my favorite analogies. I think the first time I put this presentation together was right around Christmas time. And you know how Ralphie's on that slide and he's struggling to get back up there because he forgot to tell that he really did want the Red Ryder BB gun. Well, this is how I feel half the time when my doctor walks out of the room and they've just been talking with me. I'm like, oh my gosh, I have one more question. And you just want to jump up with your little gown on and run after and chase them, right? So, so my advice here is get a little notepad. It's always so helpful to be able to write things down, and I'm going to give you some suggestions for that again later. But we've all been in this situation, and so we just want to feel more empowered by eliminating this feeling. So let's talk about how to do that. How do we feel more empowered? I think the thing you want to think about is that conversation you're having with your doctor really a conversation, or is it just he or she comes in and tells you something for 15 minutes, writes you a prescription or multiple prescriptions and then leaves because now you've reviewed your medications? Well, you want to feel like you're partnering in decisions about your own body. And truthfully, they want you right there with them because you are a team. You know more about your body because you're experiencing it from the inside out. The doctor is the medical expert and you know what's going on in your body. So there's definitely a team approach that needs to happen here for the best results for you. Okay. The other thing I want to mention at this point is the Patient Bill of Rights. And the reason why I'm mentioning it now is because it is one of the pillars that defines the relationship you have with your physician and his whole team at the office you go to or at the hospital. Each one will have a Patient Bill of Rights. And what that does is that tells you the expectations you should have for your doctor, and that tells you the expectations your doctor has for you. So a good example of this would be when you are in pain and you're in the hospital, for example, there is a whole protocol listed there about how do you let them know you take a pain medication and there's a certain time period under which they want your feedback to make sure you're getting control of the pain because the whole idea is to get control of the pain and then to not allow it to break back through. So that is a trial and error, and you have responsibility to give them feedback, and they have responsibility to then take that feedback and keep you properly medicated. So that's a really good example there. So I think one thing that we really want to talk about too is how do you actually select or evaluate your care team? And I'm saying care team because it's not just your doctor you want to select and evaluate. It is every single person that you have conversation with. When you open that door, they are all part of the team. They are part of your healthcare experience. So I know for me, I had a doctor I live in Summerfield, North Carolina, and most of my doctors are therefore in Greensboro. So I had a doctor in Greensboro who was a fabulous, very intelligent person, but his staff was short with me. I never felt really cared for. They didn't even ask me how I was doing. It was it was too clinical, to be honest. And so I finally told him that that was my experience and that I was gonna pick another physician. So I think that's very important to really be in the state of evaluating that relationship. Think about your goals and your preferences. And again, this can come back to that patient bill of rights. You actually have the preference of whether to pick a male or female nurse, doctor, anyone that's caring for you. You have that right. You may need a medical doctor, or you may just want to have a physician's assistant, whatever you're comfortable with. I know I have both. I have one of my doctors, I see a physician's assistant, and then if I have questions beyond that person, then I can ask my doctor as well. So there's a lot of flexibility there, particularly now. You can also interview your doctors, and sometimes they'll do this on a one-to-one basis or even in a group situation, and just get a first impression. Also, you're welcome to check online for their licensing and board certifications. They usually have these also framed in their office if you're in there talking to them. I personally don't know where any of my doctors went to med school, just because to me it's more about how I feel their competency is in terms of treating me when I walk in that door. And again, looking at this, are you feeling comfortable and cared for? And I think that is so important. The other thing in terms of their performance is, are your questions being answered, and are they making referrals for you to other specialists in a timely manner? This is a tricky slide, and I actually at one point had taken it out of my presentation because I think it can get awkward when you feel like you need to pick another doctor, and I've described a situation like that I've experienced. But if that practice style is abrupt or intimidating to you, then that is a point of concern. If you're having difficulty scheduling appointments or getting nurse callbacks, then you can have the greatest doctor in the world, but if you're not getting that feedback in a manner that's comfortable for you, then that's definitely a concern for you. It's an individual decision. Just like what do you do if you've experienced a preventable error? And I can give you an example of that. You probably have examples of your own, but I had one case where I had a test result that always got mailed to me in my post office. And so when I picked it up, I actually had someone else's result. So that's definitely a preventable error, but it did not shake my confidence in that practice. So that's what you need to think about is, how has that impacted your relationship with that practice? So that's something only you can answer. So I want to give you some more ideas about just how to make the whole process a little easier for you. So one of the things that I have had doctors say to me repeatedly is, I wish my patients that needed to see me would not wait until Friday to call me. Because even though you don't want to go into the weekend with something going on, you also don't want to wait until Friday if you've got symptoms going on Wednesday. Go ahead and make that call. Also, if you're just trying to get a well care visit or your annual physical, maybe skip Monday in terms of calling to make a regular appointment, because even though some practices do have more staff on Mondays, it's still to your advantage to wait. You're probably going to end up on hold for a while. Once you're at the doctor, just realize that you really should only be waiting about 20 to 30 minutes past your appointment time. And I know I know that's probably not realistic, but really that is what it should be. So feel free to say to the receptionist, I have been waiting 30 minutes, and then ask them for an update on the doctor's schedule. So how do you how do you even take it a step further and look at this and try to prevent this from happening at all? So I would say to you, when you call to make your appointment, especially if you need to have blood taken, for example, where you're going to need to be fasting, get the earliest appointment in the day you can. Do not take an 11 a.m. appointment if you're going to need a fasting blood draw and you're going to have to fast for the whole morning. I mean, there's nobody that needs to, that's not necessary, so schedule that accordingly. Also, sometimes it can help to get the first appointment after lunch. In a lot of practices, that's like the 2 p.m. appointment. So once you figure that out, take that appointment so you know that your chances of having to wait beyond the 20 to 30 minutes are reduced. And like I said earlier, if you're having symptoms, go ahead and make the call, make the connection with the nurse so that they know you're having problems, just so that you don't have to try to get everything done on a Friday. That just creates more stress for you. In terms of that wait time, I did want to mention to you that if you're going to someplace like a research hospital like Duke or UNC, you may have to wait longer, and that's I think to be expected. But once again, you should have an idea of that once you get to the office. So once you get there, or even before you get there, I mentioned before that getting a notebook and writing things down is a great idea, but it's really even helpful before you ever get to the doctor. If you've made an appointment for July, now would be a good time to start writing down symptoms that you're having or other medical experiences that you've had since you've seen this doctor last. So just so that they know what has been going on with you, it gives you time to kind of digest the fact that you're seeing this doctor before you actually walk in the door. And then bring all your records and your medications or write them down. And I'll tell you something, I don't know how many of you have an iPhone or a phone with a camera. You can take pictures of a lot of things and have it for yourself electronically, and that is very helpful too. I really like this. Take your intuition, faith, and assertiveness with you to the doctor. And that's because it is an intimidating place. You end up with somebody, poking you, taking a blood draw, taking your blood pressure. You do feel a little bit like a pincushion sometimes. And also if you're, wearing a gown, you feel like you're just not in your street clothes. So it's definitely a little bit intimidating. And I would just say to you, there's a couple of things you can do here in addition to writing down and keeping a notebook with you so you're going to remember those questions or those concerns you have. When they take your vital signs, just if they don't volunteer what your blood pressure is, just ask. And that is because that helps you practice being assertive with that doctor. Again, it gives you the opportunity to ask a question, a simple question. So if you have a situation where you need to ask other questions, you're establishing that you're interested in your own health, and you're also letting them know that you are going to ask questions. So it just opens the door for some confidence for you. I think it's always a good idea to repeatedly let them know the purpose of your visit. And generally they will just ask you this. And again, we're going to talk about the computer and just say to you, try not to be annoyed by that. I know it can be so frustrating because you're sitting there with the doctor and all of a sudden he opens up this laptop and now you've got this thing between you that 5 years ago was not even an issue, right? But But if he wasn't doing that or she wasn't doing that, you would not have the opportunity to use that patient portal and print out your test results and information at home. So there's a huge advantage for you, but it does just create sometimes an annoyance. And I think they're probably as annoyed as you are sometimes. So just bear with that little necessary technology. But I think once you've kind of got all those things, you're really ready to see your physician and use that notebook as a point of reference. Are there any questions at this point? Okay. Now we're going to talk about what you actually do while you're with your doctor. And, you know, looking at the average over the past decade or more, you really do have somewhere between 13 and 15 minutes with your doctor. That's not a lot of time. So you really want to stay focused. And I think having that notebook with you is a great way to do that. Exchange a pleasant greeting and then start the conversation. I know you're going to be tempted to show pictures of your children or grandchildren or the new puppy you got during isolation here with COVID, but try to avoid that until you get past the initial conversation where you're stating your purpose of your visit and you're taking the opportunity to refer to that notebook so you really get a targeted conversation with your doctor. One thing you always want to do, and I think this goes back to some of that AARP information we were talking about before, is how do you feel about your health? What are the things that you can tackle and improve upon for your own healthcare experience? And what are the things that you're not so good at? Or what are the things that you want to make better for yourself? So how you feel about your health is so important for you and for your doctor to clearly understand. Also, we're back to that notebook again, because for me, if I don't have my awkward questions written down in that notebook, I'm going to blow them off and not ask them. So I'm never going to get the answer. So make sure if there's something that you want to ask, but you're a little timid about, write that down. And even you can ask them to even write down the answer for you. Okay. And if they give you an answer that you don't understand, going back to that initial slide, just ask for a repetition or ask for a handout, ask for some one-on-one time with your physician or your healthcare provider that you want to talk to. This is all okay. So now you're with the doctor and perhaps there's been a diagnosis or discussion of a medication that you may be asked to take, maybe for the first time, or maybe something that you took previously and that might need to be reintroduced. So there are a few things that you can do here. And in some cases, they're a little more complicated than others, but basically, you know, one of the first things you can ask is, do I really need this medication, or can I make a lifestyle change? So I know for me, my cholesterol was higher than it should have been. This has been several years ago. It was higher than it should have been. And my doctor said, well, we can put you on a cholesterol med, or let's make some changes and I'll see you in about 6 months and let's see what that number looks like. Well, I knew that I had been spending the summer eating gummy worms and all kinds of junk with my 2- and 5-year-old kids. So I took the initiative to make some changes, and it brought my cholesterol down a little bit, but that's something I'll continue to have to work on. So again, you know, that's something you will have to decide if you're willing to make make a change. So then I think once you get past that question, if you do need to take a medication, then your doctor you might want to ask your doctor, why did you pick this particular drug? And what are the side effects and interactions with the other medications that I'm taking? So that's why it's so important to then let them know every single thing you're taking. And this will include your vitamins as well. So there are a couple of herbal supplements that are constantly, I see in prescribing information as being things that interact with medication. So one that comes to mind is St. John's wort and antibiotics or birth control pills. So those are the kind of things that they need to know. And this is because they compete for metabolism in the liver, so you don't get the full benefit of either one. That's just the simple explanation, but that's the whole point, is everything is a chemical in terms of what's going on with your body. And so then in terms of cost, you know, you can just ask how much it's going to cost. I know that there are apps that you can get now. GoodRx.com is a valuable resource in terms of finding out the actual cost of medications from pharmacy to pharmacy. So, and I think I'm doing a whole nother presentation in July about these kinds of things, or so we'll talk about that more. Another thing to ask is there a generic that is equivalent? And in most cases, you'll automatically get a generic that is a substitute for a brand name. But there could also be a case where you might be able to start on a generic, even though the first choice the doctor gives you is a patented medication. So you just have to ask that. And one thing, you know, one thing too is I would urge you to do is not go into your doctor asking about a medication you've seen advertised on TV, because those are always under patent, which means they're going to cost you much more money than a generic for that same medical issue. So just be careful with that. There is a real issue called the donut hole, and I think you're probably all aware of that, but you just have to be careful, particularly with patented medications there. So another thing to consider is that if this is a non-emergency situation, you can take your diagnosis and the options for medications and get a second opinion if you'd like. There's not necessarily a need to make a hasty decision, and it might not be in your best interest to just expect your doctor to come up with a solution then and there. It might be something that you can work on together, whether that involves a medication or a diagnostic test, either way. So just think about that too. You don't have to necessarily make a decision in that 15-minute interval of time. And it, you know, it's if you're looking at medications and your doctor is wanting to change some things, or you're asking if things can be changed, I would advocate that you only change one thing at a time unless your doctor advises otherwise, because once you start changing more than one thing or adding more than one thing, you are not going to know the effect of the change, because it could come from more than one source. So just think about that perspective. I know sometimes your doctor will say, well, I know from experience what these two changes will do. And so of course you trust that judgment, but I'm just saying that's a point to consider. I wanted to put this in here because last year I had a broken pinky toe that cost me $1,000, and I have insurance. So that's why I put this. It was very stressful to open those envelopes. I think it's so hard for us to understand what is going on in the billing area. And, you know, I look at my colleagues who are independent patient advocates, and some of them do this. This is what they do. And so when I have a client that is in this situation where the stress of opening that envelope is just as impactful as the actual medical issue, then I refer them to my patient advocate friends who are working on billing, because it is a complete other subject. So with that, I want to talk to you a little bit about what independent patient advocates do. And certainly many of them do work on billing, but what they can do is really provide you with a lot of support. And it is based on personalized support for you. So because we are private pay, we do not work directly with the healthcare provider. We are aligned with you and your family. So for me, what my services are is I work on, from a scientific standpoint, as a chemist, I work on interpreting drug interactions and treatment options, and I prepare questions for my clients to ask their physician or their pharmacist directly. And then I will also accompany my clients to their medical appointments. what I give my clients looks something like this. And I know this is a lot of information on one page, but I just want you to see what it looks like and some of the things that I do to provide you with information. So this is the table that I use to support the questions that I give you to ask your physician directly. But this is what that looks like. So you're seeing that ABC score on there, and that is the cognitive burden score that I was talking to you about earlier. And what that does is that ranks the impact on mental clarity of a certain medication. So here, in this example, this is redacted, but in this example, this person has 2 medications with a cognitive burden score of 1, which means that they have might have some mild impact from their medications. So just looking at independent patient advocacy, there are some huge benefits to having someone with you. And it doesn't have to be an independent advocate that you pay for. It can be what I did for 2 decades as a volunteer. But you want to have someone who is able to help you figure out what you don't know. You don't know what you don't know. And, you know, we've seen this so much with COVID, where we're piloting the plane and building it at the same time in terms of our knowledge about COVID-19. That is what happens with you if you've got a diagnosis that you need to walk through. So it's always nice to have someone who can step back and ask those questions, because you're going to be emotionally involved, and probably your spouse or your son or daughter will be too. So you want to have someone that cares but is slightly removed. Our healthcare practitioner. Yes.
We do have a question from Kathy. She said, if you had the original shingles shot years ago, Zyrtex, do you still need the newer version of the shingles 2 shots?
I would strongly consider doing that. I don't know if your insurance would pay for that or not, but I would strongly consider doing that. The Shingrix is supposed to be a much improved vaccine. So ask your physician, you know, based on your situation, but I would advocate that you certainly ask about that. It is a much better vaccine from everything I understand about it. Okay, but it is a series of 2 vaccines, so just be aware of that. And then, you know, the other thing too is if you are approved to get it, then you want to make sure that your pharmacy or whoever is administering that vaccine is saving that second vaccine in the series for you, because there have been shortages. So there's a certain time window there. You want to make sure you get your second dose. Okay, again, you know, talking about patient advocate, you really want to understand that if there's not someone coordinating your care, make sure that there is someone that can do that for you. And it can be a patient advocate, or it can be, you know, one of your doctors. And so I use this example because I think you kind of automatically assume that your primary care doctor would play that role, but you really want to make the conscious decision to invite them to play that role, even if it's your primary care doctor, or if you would prefer your cardiologist, if you have had some heart issues in the past, or if you have AFib issues, you may want to use your cardiologist as the hub in your medical wheel, so to speak. So invite them to do that. Don't just assume that someone has got your back in your medical team, because they may not know that they're supposed to play that role with you. So invite them to do that. And as we have been, you know, talking about during this whole presentation, make sure you're participating in your own healthcare decisions, and get yourself to the point where you're taking that posture, because you're going to have better outcomes, and you're going to have better relationships with your healthcare providers. Yeah, Brian, I definitely cannot see the question, so thank you for that. And in closing, I do want to just show you my resources, because I think that's so important. And I've used multiple resources to build this and other presentations. So here's just some examples of some books that I've read and some websites that I've looked at. So please, you know, Particularly AARP publications are quite helpful and easy to read. That Choosing Wisely website that I've mentioned a couple of times is quite a resource, and you will need to play with it a little bit, but it has got some great information put out there by specialists in their field. These are some other things from Choosing Wisely, and I just wanted to show you that as well. I think it's really important to just ask some questions. You don't have to come across like a rocket scientist, because you're not, probably. And you just want to be thoughtful and make sure that your healthcare providers know that you're interested in your own healthcare. This is that cognitive burden scoring that I was telling you about. And so you can just see on here, you know, one of the things we've been talking about a lot in healthcare is diphenhydramine or Benadryl, and it has a cognitive burden score of 3. So you know what that feels like. You've taken some Benadryl because you had a bee sting or because of an allergic reaction, and the next thing you know, you're asleep on the couch. Whereas if you're taking something else, Claritin, for example, over here in this left-hand column, it's got a cognitive burden score of 1. It's a second generation antihistamine, so it doesn't make you quite as drowsy as Benadryl. So that's just something to consider with all of your medications. It's something to ask. These are
Andrea,
some more.
we have another question. I'm sorry.
That's okay. No, please.
Kathy asked, should one not take, I'm going to butcher this word, I'm sorry, Megared omega-3 krill oil? I am for high cholesterol, but wondered, since it contains shellfish, that I should not take it.
Do you have an allergy?
Let me see if I can unmute Kathy and she can.
Yeah.
Kathy, you should be able to talk now.
Hello, can you hear me?
Yes, I can.
Okay, I was telling him I take Mega Red Krill oil, fish oil, whatever you call it, and I thought that might help my cholesterol's high. And then somebody said, well, it's got shellfish in it, maybe you shouldn't take it. Mega Red.
I know that some doctors advise that and others question it. So I would just say the next time you go to your doctor, ask them and show them all of your medications, because sometimes taking that may not be the best choice depending on what your other medications are. So just ask the question.
Okay.
Yeah, that's what I would do.
Thank you.
Yeah, because like I said, you know, it's just when you get into vitamins and that kind of thing, it gets tricky because they don't go through the same process as a medication like your medications, like your statins. Those have all been through FDA approval and clinical trials, and most of those vitamins and herbals have not, and there's not a lot of oversight there. So they're considered food. They're not considered medications. So
thank you.
You're welcome. This is another valuable resource called the Beers Criteria, and there are a couple of different categories for Beers Criteria. And I know this says 2012, but the facts remain the same. And it's just whether you should be using these as an older adult. So hold on just a second. Here we go. There we go. So there's just another page of that. And just medications to be cautious with older adults as well. So these are valuable resources. And I did just want to share, I have a brief testimonial from a client who actually, it's been a while, I actually did volunteer work with them, and they say, in 2012, I was taking intense chemotherapy drugs in preparation for a stem cell transplant following a recurrence of non-Hodgkin's lymphoma. Initiation of the transplant was stalled when the research hospital was unable to obtain the only available biopsy results originating at a regional hospital. Another biopsy was not an option as there was no remaining cancerous tissue in my body. Andrea Alamani, owner of Patient Navigation Team, intervened on my behalf, acting as a liaison between the hospitals. She was able to locate the vital results, and I hand delivered those to the research hospital. I successfully underwent the stem cell transplant procedure, which was ultimately determined by the biopsy results rediscovered by Ms. Alamani. So that's the kind of thing, that's the kind of story I want to be a part of every single time, is making a difference for a patient or a family and helping them communicate with their doctor, and likewise helping the doctor communicate with them, because sometimes that's just difficult. And so that is the goal for me, is to facilitate that relationship. And I think with that, I'll close. And I hope that this presentation has offered you the opportunity to become a more confident medical consumer. And thank you so much, Brian, and to the New College Institute for inviting me to participate in your L.I.F.E lecture series. Thank you.
Thank you so much, Andrea, for doing this for us. It's been a wonderful presentation. And again, thank you for Kathy for joining us today. Kathy did say it was very informative, and she says thank you again. So again, I will end this recording now.